So let's try and do this one. So first off, I think last time we had a stress fracture, and this all looks very, very smooth, doesn't it? We kind of just go along like so, go along like so. Everything looks pretty good so far. Nothing obvious going on there at all. We can't see any evidence of a stress fracture whatsoever in this particular region. Now look at the metatarsal heads. Do they look flattened? I mean, you may convince yourself it looks a little bit flattened, but it's not what we're looking for when we're looking for Freiberg's infraction. What we're actually looking for when it comes to Freiberg infraction is the increased sclerosis. And Freiberg's infraction is when you get a stress reaction, maybe because they're marching a lot and they get sort of avascular necrosis, as it were, within the region of the metatarsal head, which results in a bit of collapse and all the rest of it. And then you end up getting a very abnormal appearance to that metatarsal head. We don't have anything like that in this particular situation here. Now we come across to the toe, the big toe, we can see that this doesn't look quite nicely angled. It's kind of angled towards that way, isn't it? So if I drew a line, it's not going straight, it's kind of angled off that way. So this is going to be a Hallux Valgus leaving the midline of the body, the Hallux Valgus deformity. Someone has picked it up. Well done. Okay, and then this is what I was trying to tell you about. So I'm trying to allude you to something earlier, try and build on what we saw before. If you did draw a line around that nail bed, you can see that nail bed goes like so, but there is another radiolucency that goes along like this, all the way along like this, and all the way along like this. Can be quite subtle. People can kind of ignore it. Let's zoom in just to convince everyone that I'm not telling lies. Have a look. So let's draw that nail bed like so, all the way along like this. And it's not, the nail bed's not going to go like this way, is it? It's going to, you can kind of see the nail bed going along that way and that way like this. It doesn't have that hyperdense appearance of, someone getting some nail work done. This is a radiolucency going right through that terminal tuft, and that is pretty abnormal. And then when you look at the other view, what you can see is this much more obvious linear hyperdensity going through that terminal tuft, and you can see that there. Look, I'm going to draw it like this, It's non-displaced. I know you can get sort of a lot of radiolucencies, a bit of overlap sometimes of that terminal tuft, but this radiolucent going all the way down like so is completely abnormal, meaning that they've got a fracture. Sometimes the clue could be that they've got a lot of soft tissue swelling. That's a bit of an exaggeration, isn't it? A bit of soft tissue swelling, but I wouldn't really call it based on that bit of soft tissue swelling. Not something I'd be worried about, but that is clearly abnormal. Okay, so well done. Someone's picked that up and picked it up very, very quickly. So that's awesome. Well done.